Hello, my name's Dr. Gillian Ray-Barruel and I'm a Senior Research Fellow with QE2 Hospital and Griffith University. I've put together a couple of short videos on essentials of evidence-based practice, and in part one I'll be discussing what is research versus quality improvement, some common study designs, and offering you some tips where to find useful resources for your work. What is evidence-based practice? Well, evidence-based practice is about using the best available evidence to guide clinical practice so patients receive the best possible care. I'm sure we all agree with that. How did it begin? Well, Dr. Archie Cochrane in 1972 wrote a book called Effectiveness and Efficiency: Random Reflections on Health Services, in which he criticised the medical profession for not using more vigorous methods, and he believed medical practice should be based on evidence. He in fact advocated randomised controlled trials to generate rigorous evidence. Now, back then that was quite controversial. It's no longer so. We now have the Cochrane collaboration, systematic reviews of evidence. So you can search online by the Cochrane collaboration for any question that you have in your practice, and somebody else might have already looked at that and come up with a summary of evidence to support or refute that practice. But how do we decide about evidence? Well, we have this evidence pyramid. Now, at the very, very top of the pyramid are things like meta-analyses of systematic reviews, right down to the very, very bottom of the pyramid where we have animal research. Now you can see there that on the second lowest rung is the textbook and the expert opinion. Now the textbooks are there because it can sometimes take up to 5 years to get a textbook into print, and by the time they're printed, evidence might have moved on. And I'm sure you would agree that expert opinion is not really very strong evidence. We all have our own opinions about things. Much of that is based in our own experience, but oftentimes it's not very rigorous. Climbing up the pyramid, we see things like case reports or case control studies, cohort studies, to the highest type of design, which is a randomised controlled trial. A systematic review gathers a lot of randomised controlled trials together and compares the evidence of each. And a meta-analysis takes the data from all of those randomised controlled trials, reanalyses it to discuss whether or not that data is really rigorous and whether those results can be trusted. Getting started in making improvements in the workplace can be a challenge. On the Queensland Health QEPS website, there is this improvement pathway, which I find particularly useful. Here we have some questions. The first one is define the problem or issue you'd like to improve. What is or are the aims of the project? Go and search literature. And then think about, will the project gather new knowledge? If the answer to that is yes, it is a research project. If the answer is no, it won't be new knowledge, it's a quality improvement project. And I'll make that a bit clearer. When you go to that website and you click on the research project, it guides you through a whole series of steps about generating new evidence. I strongly recommend that you take a look at this website and work through the steps if this is what you're hoping to do. The Quality Improvement Project also has a paradigm that you can follow for implementing existing evidence. And each of these little boxes is a link to another page which can give you some directions. You don't have to go this alone. Let's ask some questions here. Is this research or quality improvement? The pharmacy informs you that the hospital is participating in a randomised controlled trial of pre-filled saline flush syringes versus manual saline flush syringes. Research or quality improvement? Well, that would be research because it's a randomised controlled trial, and as we know, that's the highest level of trial evidence. What about this one? An ICU nurse reads a research article describing the positive effects of staff interaction between ICU patients and families after encouraging families to bring in photos of the patient when they were well. The nurse is keen to implement this idea in the unit and see if there is a positive response among staff, patients and families. Well, this is quality improvement. She's read that this worked elsewhere in an ICU and she wants to trial it in her own unit. This one. A bed-bound patient is not wearing TED stockings. The nurse caring for the patient states that the patient has poor skin integrity, so they decided not to apply stockings. You decide to do a literature review to see what is the best practice for this type of patient. You identify there is a product designed to facilitate TED stocking application and decide to trial this product in your ward. Is that research or quality improvement? Well, if the device has been tested in this patient population before, it's quality improvement. You would be implementing existing evidence. If the device has not been tested in this type of patient population before, it's research. You're generating new knowledge. So, to do a literature review, we're interested in what research has already been done in the field. We also want to know what research methods are used in this field. It's helpful to know who are the key researchers in the field and what is still unknown or unclear. Where's the gap? Because the gap is where you can do research to generate new evidence. Now, there are two ways of approaching research. One is using deduction. So this comes from Aristotle. You begin with a theory, you come up with a hypothesis, you do some observations, and you either confirm or refute your hypothesis. Whereas induction is more like Sherlock Holmes. You observe, you notice patterns, you come up with a hypothesis to fit the pattern, and then you test your theory. Very different approaches. So quantitative research is objective and mostly deductive, usually focused on numerical data, usually has many participants and samples, and the data analysis is by statistical methods. So these are experimental, also called empirical designs. Things such as what we saw in the pyramid, randomised controlled trials, quasi-experimental trials, factorial, crossover, time series and cohort studies, case control studies. They're all experiments. But we also have non-experimental designs. These are things such as observational studies, descriptive, surveys, developmental, following people over time, longitudinal, systematic reviews, meta-analyses and secondary analysis. So in non-experimental designs, you're not actually doing anything to a population, but you are observing and understanding the data from a different perspective. Whereas experimental, you're actually doing something to that population and then studying the result. Now, qualitative research is quite different. It's quite subjective. It may be deductive or inductive. In other words, starting from a theory and then gathering evidence, or starting from observation and creating a theory. It's usually quite often focused on life experiences, usually has fewer participants but richer data. And qualitative research designs include such things as phenomenology, ethnography, grounded theory, participatory action research, narrative theory, and discourse analysis. And qualitative research methods are things such as interviews, focus groups, case studies, and narratives. And you would analyse this data by thematic analysis or content analysis. So, let's have a think. Is this quantitative or qualitative research? A patient in your ward has a bloodstream infection. The infection control department suspects this is IV catheter related and decides to do audits of aseptic technique during PIVC insertions, peripheral intravenous catheter insertions. Would that be quantitative or qualitative? Well, it's quantitative because you're doing audits. So you're observing data and noting how many patients had good aseptic technique, etc. That's quantitative. Anytime you ask how many, it's quantitative. What about this one? Nursing sick leave has steadily increased in one ward over the past 6 months. The nurse unit manager suspects this could be in response to the high patient acuity and many changes occurring in the ward over the past year. She would like to find out nurses' honest opinions about what they think is going on. She asks the nurse researcher to run some focus groups among the staff. And that would be qualitative research. Running focus groups to try to find out the experience of the staff in the unit. So that's clearly qualitative. You will note that the nurse unit manager is not the one who's going to be asking the staff about what they think. I'm sure she wouldn't get honest opinions. So to run a focus group, it's best to get somebody who's impartial from outside the area. What about this one? You have created a new assessment tool and decided to trial it in 3 wards. You suspect it could be difficult to implement and wonder what might be the best method. Well, you decide on a mixed methods approach. Multiple clinical audits, which would be quantitative, and focus groups, which would be qualitative. Very yin and yang approach, the mixed methods. But you need to do both in this situation. How do you translate research into practice? This is also called knowledge translation or implementation science. It's important to be aware that having the best evidence does not ensure best practice implementation. You also need to consider barriers and facilitators. Barriers are things such as time, workload, competing pressures, not enough support for the idea, too many changes going on at the same time and people are overloaded, not enough money to run the project, too difficult. You know, there's always roadblocks that can pop up in the way. Facilitators are absolutely essential to getting your research or your quality improvement idea into practice. You can't really get success without leadership support, project champions, preferably some good education resources, staff to help. Incentives and rewards are always appreciated by staff, and this can be as simple as praise or recognition at a team meeting, certificates of appreciation, chocolates, maybe even a bottle of wine. Just getting people on board will greatly help your project. You can't do it alone. So how do you get started? Well, in this presentation, I've had various books popping up on the screen. All these books are in the QE2 library, available for you to borrow, and there's some really excellent resources there for nurses and for allied health and anyone who's wanting to do some research or quality improvement. And don't forget, QEPS has some excellent resources for research. This is the Metro South website for research. And on here, you can find some really excellent help for how to get started in your research. What about the new ethics and research governance system? Looking at how do you initiate and plan your project? What research services are available to help you in Metro South? Because they are out there. Setting up your project, maintaining and managing your project, or closing a project. All of these are links and they all have some excellent information. For example, this is the research journey, and again, every single one of those circles contains a link to help you with your research journey. And this contains things such as, are you doing a clinical trial, or are you doing an audit? What sort of research are you doing? Are you tapping into existing data sources, or are you creating your new data? How are you going to get research funding? What about ethical clearance, governance? What about monitoring the study, safety reporting, research integrity, relevant bodies, publications, presentations? Maybe you want to translate your research into another language. So all kinds of interesting things going on here. This is just an example. So initiating and planning your research project tells you how to get in touch with the ethics committee and discuss your ideas before you even get started, so you can discuss the level of risk. So any research, because it's new evidence, it's considered to have some level of risk, but that can often be very low or negligible risk. But it's important to speak to somebody who understands this prior to setting up your project, so that you can get through all the nuts and bolts and make sure that you're doing the right steps. The ethics committee will also help you with choosing which documentation you need to support your project. So on the research website also, there's a whole list of policies and procedures for research, and the ethics committee will often direct you to these. For example, if you were taking biospecimens, then you clearly need a certain level of research ethics approval to do that. But there's a whole bunch of procedures there that are very useful. Not relevant to every project, but certainly relevant to some, and it's good to know where they're kept. This is another useful page on this site. Quick links, tools, forms and templates. And again, this runs through, all the things that you might need to do to get your project up and running. Metro South offers education for research. There is ethics review manager training. These are short sessions. They also have drop-in sessions. Metro South has a biostatistics service which you can utilise. They offer good clinical practice training and power trials training. And this, for example, is the new ERM training, so Ethics Research Manager training. Here we have CKN, which I'm sure you're familiar with. It's on all of the Queensland Health computers, and it is a portal to all the resources that you would need to get started with your research or quality improvement projects. You can see here we have point of care databases, e-journals and books, clinical guidelines, all sorts of useful links. Some databases that you would be tapping into, as I mentioned, the Cochrane Library is a great one for starting to see if there's any robust evidence on your topic. CINAHL is useful for nursing and allied health. PsycInfo, very good for qualitative and psychological studies. Medline Complete, very good for medical and nursing and allied health. PubMed, also good for nursing and medicine. And Ost Health. The librarian at QE2 is very, very happy to help you navigate and negotiate the CKN website. So please get in touch with her. So QE2 also has its own library services webpage, and you can see here that there's a link to research at QE2. Here we have the QE2 Nursing Research Support Service, which is something that I have set up. The Metro South Health Centre for Health Research, undertaking research in Metro South, and frequently asked questions. So all those links that I've showed you can be accessed from the Research at QE2 website. And if you go into the Nursing Research Support Service page, I've put together some resources that I believe will be very helpful for you. To begin, if you haven't already done so, I'd love you to do the QE2 Nursing Research Survey of 2019, in which I can get a baseline of who in the hospital is doing research or who is studying and could use a bit of help. Also, I'd like to know what sort of services you would like from me. I've put together a list there about the service of all the services I believe I can help you with. But if there's something else, come and have a chat. I do have drop-in hours in the library once a fortnight, and I'm running workshops. I've also put together here some links and research tools which I think are extremely useful. These are some of the key tools that I use every day. If you come across an amazing link or research tool, please let me know, and our lovely library technician, Meredith, will help put the link on the website. The PA Library Home is also an excellent resource. They have some really terrific things on this page. And I could not do my job without the Equator Network. I think it is an amazing resource. Basically what this is, has all the reporting guidelines of all the main study types, and it has checklists for how to do your research and write it up afterwards. So I think it's absolutely invaluable, and if you are new to research and want to start off on a really strong footing, I recommend the Equator Network. Of course, you can't do any research without considering the ethics of doing research. Medical and nursing research has quite a poor history of mistreating and abusing the privilege of being researchers. So we now have very strong principles of ethical conduct of research, and it's important that you understand what you can and you cannot do in your research. You need to consider the risks or benefits to the patient or participant, and you will need informed consent to do research. It doesn't always need to be written, but it does need to be informed consent. Of course, that's when dealing with humans. but there's also research ethics for animals and genomes. There's in vitro and in vivo research. There's ethical considerations for vulnerable populations, such as Indigenous, Aboriginal and Torres Strait Islander peoples, the elderly, people with impaired capacity, people, young children, etc. And the national statement also covers principles of research governance and ethical review. If you're doing a clinical trial, then you would also be consulting the Australian Clinical Trials Handbook, which provides governance on conducting clinical trials in Australia. For further information, please visit the QE2 Nursing Research Support Service webpage. You can register for upcoming research workshops on LEAP Online. You can attend a drop-in session offered each fortnight in the QE2 fifth floor library, speak to our friendly library staff, or you can email me, gillian.ray-barruel@health.queensland.gov.au. Thanks for listening.